Every common pregnancy pain. Explained lower back pain. Your lower back hurts because your spine is recalculating load distribution in real time. As pregnancy shifts your center of gravity forward, your lumbar spine compensates by increasing its curve. The relaxin hormone loosens spinal ligaments that normally stabilize vertebrae. Your abdominal muscles stretch and weaken, removing frontal support. Weight accumulates anteriorly, while postural muscles work overtime to prevent forward collapse. This creates mechanical stress that intensifies with every pound gained. The sensation ranges from dull, constant ache across the lower spine to sharp spasms that catch during movement. Some describe deep muscle fatigue that worsens throughout the day. Others experience stabbing pain with specific activities like standing from seated position or lifting objects. The discomfort often radiates horizontally across the back rather than downward. Lower back pain typically begins in late first trimester as weight gain accelerates. It peaks during third trimester when anterior weight reaches maximum and postural compensation becomes most extreme. Some women experience relief when the baby drops into the pelvis weeks before delivery, while others endure increasing pain until birth. Normal severity means discomfort that responds to position changes, rest, and movement modification. Concerning severity includes pain that immobilizes you, radiates down one or both legs, accompanies numbness or tingling, or causes loss of bladder control. Your spine is performing structural engineering calculations every moment, adapting architecture to shifting loads that would buckle rigid systems. Pelvic girdle pain. Your pelvis hurts because bones designed for stability are becoming mobile. The relaxin hormone loosens the symphysis pubis, the cartilage joint connecting your pubic bones at the front, and the sacroiliac joints connecting your spine to your pelvis at the back. These joints, normally nearly immobile, begin separating and shifting. Ligaments stretch beyond their typical range. Your pelvic ring, engineered as a solid foundation, transforms into a flexible structure preparing to expand during birth. The pain feels like deep, grinding, clicking, or the sensation that your pelvis might separate entirely. You might hear audible clicks when walking or rolling over. Some describe it as bones scraping against each other. Others feel sharp, catching pain with specific movements. The discomfort centers in the pubic area, lower back, or deep in the hip joints. Stairs, walking, standing on one leg, and rolling in bed trigger intense sensations. Pelvic girdle pain typically begins in second trimester as relaxin levels rise and joint loosening becomes significant. It intensifies progressively with weight gain and increased joint mobility. Third trimester brings peak intensity as maximum loosening coincides with maximum weight. Movement provokes pain more than stillness. Normal severity ranges from occasional twinges during specific activities to moderate discomfort that limits certain movements. Concerning severity includes debilitating inability to bear weight, pain so severe you cannot walk, or sudden sharp pain accompanied by a popping sensation. Your pelvis is literally becoming mobile architecture, trading structural stability for the flexibility required to pass a human skull through bone. Round ligament pain. Your groin and lower abdomen hurt because two thick ligaments are stretching at unprecedented speed. Round ligaments connect each side of your uterus to your groin, anchoring the organ in position. As your uterus expands from pear size to watermelon size, these ligaments stretch rapidly. Quick movements cause sudden tension. The ligaments contain nerve fibers that register this stress as sharp pain. They are the only structures preventing your expanding uterus from floating freely in your abdominal cavity. The sensation is sudden, sharp, stabbing pain in your lower abdomen or groin, typically on one side. It strikes during quick movements, sneezing, coughing, standing abruptly, laughing, or rolling over in bed. The pain feels like a pulled muscle or a knife-like jab. It lasts seconds to minutes, then disappears completely. Some women describe it as lightning bolts shooting through their pelvis. Round ligament pain is most common in second trimester when uterine growth rate reaches its peak velocity. It can begin in late first trimester and continue through third trimester, but intensity typically decreases as ligaments finish their maximum stretching. The pain occurs sporadically throughout the day, triggered by movement rather than position. Normal severity is brief, sharp, one-sided pain that resolves within minutes in response to slowing down movements. Concerning severity includes constant pain regardless of movement, either pain accompanied by bleeding or cramping, or severe pain on both sides simultaneously. These ligaments are stressed precisely because they are working. They are the only thing preventing your uterus from becoming an unanchored balloon. Leg cramps. Your calves seize at night because your body is rationing minerals between two skeletons. As the fetus builds its skeletal system, calcium and magnesium demands intensify. Your blood volume increases by 50%, diluting electrolyte concentrations. The expanding uterus compresses pelvic veins, reducing circulation to your legs. Blood pools in lower extremities. Muscles receive fluctuating mineral levels and inadequate circulation simultaneously. At night, when you are horizontal and immobile, these factors converge into sudden, violent contractions. The sensation is a sudden, sciatic involuntary muscle contraction in your calf or foot, typically waking you from sleep. The muscle hardens into a visible knot. Pain intensifies rapidly from 0 to severe within seconds. Your foot might flex involuntarily into painful positions. After the initial spasm releases, residual soreness persists for hours or days. Some women describe it as the muscle trying to tear itself from the bone. Leg cramps typically begin in second trimester as fetal skeletal development accelerates and blood volume peaks. They intensify through third trimester with maximum mineral demands and circulation compromise. Nocturnal occurrence is most common, though some women experience daytime cramping during prolonged standing or walking. Normal severity ranges from brief Charlie horses lasting seconds to prolonged spasms requiring manual stretching to release. Concerning severity includes cramps accompanied by swelling, redness, warmth, or persistent pain after the spasm releases. These suggest blood clots rather than muscle cramps. Your muscles are the first system to signal that mineral negotiation between your body and the fetus is happening at their expense. Headaches. Your head pounds because your circulatory system is running at maximum capacity while your brain chemistry transforms. Estrogen and progesterone surge to levels 50 to 100 times higher than normal, dilating blood vessels throughout your brain. Your blood volume increases by 50%, stressing your circulation. Dehydration from increased fluid demands, caffeine withdrawal, physical stress, inadequate sleep, and blood sugar fluctuations compound vascular strain. Your skull contains the same space, but vessels expand and blood flow intensifies dramatically. The pain feels like a tight band wrapped around your skull, throbbing at your temples, or pressure building behind your eyes. Some describe dull, constant ache across the forehead. Others experience sharp, pulsing pain on one side. The sensation ranges from mild annoyance to migraine-level debilitation with nausea, light sensitivity, and visual disturbances. Tension-type headaches create muscle tightness in neck and shoulders. Headaches are most intense during first trimester when hormonal surges are steepest, and during third trimester when blood volume reaches peak and physical stress maximizes. Second trimester often brings relative relief as the body adjusts to new hormonal baseline. Some women experience daily headaches, others have occasional episodes. Normal severity means headaches that respond to rest, hydration, food, and gentle pain relief measures. Concerning severity includes sudden severe onset, unlike previous headaches, visual changes like flashing lights or blind spots, headache accompanied by facial swelling or upper abdominal pain, or headache with fever and neck stiffness. Your circulatory system operates as a pressure gauge displaying the immense biological work occurring inside your skull. Breast soreness. Your breasts hurt because they are constructing an entire organ system that did not exist before. Milk ducts proliferate throughout breast tissue. Blood flow increases dramatically. Fat deposits accumulate. Hormonal stimulation triggers glandular development, preparing for lactation. Your breasts are building functional milk production infrastructure in months, ducts, lobules, alveoli, that will manufacture customized nutrition on demand. This rapid construction involves tissue stretching, nerve compression, and vascular expansion. The sensation ranges from tender sensitivity when touched to deep, constant aching throughout the tissue. Some women feel burning sensations or shooting pains through the breast. Nipples become hypersensitive. Even clothing contact creates discomfort. The breasts feel heavy, swollen, and fuller than normal. Some describe it as the worst breast tenderness they have experienced, surpassing premenstrual sensitivity. Breast soreness is often the first noticeable pregnancy symptom, appearing within weeks of conception. It peaks during first trimester when hormonal surges are steepest, often improving in second trimester as tissue adapts. Soreness returns in third trimester as colostrum production begins and breasts prepare for immediate postpartum function. Normal severity is generalized tenderness, swelling, and sensitivity that is symmetrical in both breasts. Concerning severity includes localized red, hot areas suggesting infection, discrete lumps that persist, or pain isolated to one specific area rather than diffuse. Your breasts are not simply growing larger. They are differentiating into a complete functional system capable of sustaining another human life. Heartburn. Your chest burns because your digestive system is being systematically compressed and relocated. Progesterone relaxes the lower esophageal sphincter, the muscular valve preventing stomach acid backflow into your esophagus. Simultaneously, your expanding uterus compresses your stomach upward, reducing its capacity and increasing internal pressure. Acid that normally remains in your stomach flows backward into your esophagus. Your stomach cannot expand downward, so pressure escapes upward, carrying acid with it. The sensation is burning rising from your stomach through your chest to your throat. You taste sour or bitter fluid in your mouth. Chest pressure can mimic cardiac pain. Some describe it as liquid fire climbing the esophagus. The burning intensifies when lying flat, bending over, or after eating. Large meals trigger immediate discomfort. Certain foods make it worse. At night, acid can reach your throat, causing coughing or choking sensations. Heartburn typically begins in second trimester as uterine size becomes significant and progesterone levels stabilize at high levels. It intensifies through third trimester as maximum compression occurs. Late pregnancy brings near constant heartburn for some women. Lying down, especially immediately after eating, provokes the worst episodes. Normal severity ranges from occasional mild discomfort after specific foods to constant burning that affects sleep quality and food choices. Concerning severity includes difficulty swallowing, vomiting blood, black stools, or severe chest pain that could indicate cardiac rather than digestive issues. Acid reflux during pregnancy represents gravity losing its battle against biology. Liquid flows upward because mechanical pressure overrides physical laws. Hip pain. Your hips hurt because joints are loosening while simultaneously bearing weight in unnatural positions. Relaxin softens hip joint cartilage and ligaments, increasing mobility but decreasing stability. Side sleeping position, necessary in later pregnancy, creates sustained pressure on joints unaccustomed to bearing full body weight laterally. The expanding uterus shifts your center of gravity, altering hip mechanics. In some positions, the uterus or baby compresses the sciatic nerve as it passes through the hip region. The pain feels like deep aching in the hip joint, burning along the outer hip and thigh, or sharp pain radiating from hip to knee. Some describe the sensation of bones grinding together. Others feel stabbing pain when rolling over or standing from sitting. The discomfort is worse on the side you sleep on. So your prolonged standing or walking aggravates it. Sciatic nerve involvement creates shooting pain, numbness, or tingling down the leg. Hip pain peaks during third trimester when weight reaches maximum, side sleeping becomes mandatory, and relaxin effects are most pronounced. Some women experience it earlier in second trimester. The pain is typically worse at night after a day of activity and first thing in the morning after hours of sustained pressure during sleep. Normal severity is positional pain relieved by movement, stretching, or changing positions. Concerning severity includes constant pain regardless of position, complete numbness in the leg, or pain accompanied by inability to bear weight on that leg. Your hips are preparing for their most extreme range of motion during birth, while simultaneously bearing weight in positions they were never designed to sustain. They are training under impossible conditions, abdominal cramping. Your abdomen cramps because your uterus is simultaneously stretching to 20 times its original size and practicing the muscular coordination required to expel its contents. Early cramping results from rapid uterine stretching and dramatically increased blood flow to the organ. Later cramping comes from Braxton Hicks contractions, your uterus rehearsing labor mechanics by tightening and releasing. The muscle fibers are lengthening, thickening, and learning coordination patterns. This transformation and training creates sensation. Early cramping feels like menstrual cramps, dull, achy discomfort in the lower abdomen. As pregnancy progresses, Braxton Hicks create a different sensation. Your entire abdomen tightens and hardens, then releases. You can feel the uterus become firm under your hand. Some women describe it as the organ squeezing itself. The tightening is painless to mildly uncomfortable. Unlike labor contractions, Braxton Hicks are irregular and do not intensify. Cramping occurs throughout pregnancy with changing character. Early pregnancy brings menstrual-like cramps. Second trimester introduces occasional Braxton Hicks. Third trimester brings frequent practice contractions, sometimes multiple times per hour. The sensations evolve as uterine function shifts from pure expansion to active preparation for labor. Normal cramping is irregular in timing, mild in intensity, and resolves with rest or position changes. Concerning cramping includes regular intervals growing closer together, severe pain rather than mild discomfort, cramping accompanied by bleeding or fluid leakage, or more than 4 contractions per hour before 37 weeks gestation. Your uterus is multitasking at the tissue level, expanding and training simultaneously for opposite mechanical functions. Rib pain. Your ribs hurt because they are the last structural frontier. When your baby runs out of downward space, everything goes upward, and your ribs announce the invasion. The baby's feet or body press directly against your rib cage from inside. Your organs, stomach, liver, intestines displace upward, crowding your diaphragm and ribs. Your rib cage itself expands, increasing circumference to accommodate compressed lungs. Cartilage connecting ribs to sternum stretches. Ribs separate slightly at the joints. The pain feels like sharp stabbing with specific movements, particularly reaching overhead or twisting. Some describe constant pressure or a bruised feeling along the ribs. Baby kicks directly to ribs create acute jabbing pain. Deep breathing becomes uncomfortable. The sensation intensifies when sitting, as this position maximizes upward compression. Lying on your back provides no relief because organs still press upward. Rib pain is most intense during third trimester when the baby reaches maximum size and position becomes most compressed. It peaks in the final weeks before the baby drops into the pelvis. Women carrying larger babies or multiples often experience earlier and more severe rib pain. The discomfort is worse during the day when upright and after eating when the stomach is full. Normal severity ranges from occasional jabs when the baby moves to constant pressure limiting deep breathing. Concerning severity includes sudden, severe pain with difficulty breathing, pain accompanied by fever or cough, or one-sided sharp pain with shortness of breath suggesting possible lung issues. Your rib cage marks the boundary where expansion meets limit. When your baby runs out of room, your ribs are the structure that bears witness to absolute capacity. Carpal tunnel syndrome. Your hands hurt because fluid does not discriminate. The same fluid retention that cushions your baby is compressing the nerves that power your hands. Pregnancy increases total body fluid by 6 to 8 liters. And this fluid accumulates in tissues throughout your body, including the narrow carpal tunnel in your wrist. The tunnel contains 9 flexor tendons and the median nerve in a confined space. Swelling compresses the nerve. Repetitive hand use compounds the compression. At night, fluid redistributes from legs to arms, intensifying wrist swelling and symptoms. The sensation is numbness, tingling, or burning in your thumb, index finger, middle finger, and half of your ring finger, the areas supplied by the median nerve. Your hand feels like it is falling asleep. You experience weakness gripping objects. Dropping things becomes common. Symptoms are worse at night or first thing in the morning. Shaking your hands provides temporary relief. Fine motor tasks like buttoning clothes become difficult. Carpal tunnel syndrome typically begins in second trimester as fluid retention becomes significant. It peaks during third trimester when total body fluid reaches maximum. Symptoms often worsen at night. Some women wake repeatedly with numb, painful hands, requiring shaking to restore sensation. The condition usually resolves within weeks after delivery as fluid levels normalize. Normal severity is intermittent numbness and tingling that improves with hand position changes and shaking. Concerning severity includes constant numbness, complete loss of thumb opposition strength, making gripping impossible, or muscle wasting at the base of the thumb, indicating prolonged severe nerve compression. Pregnancy swelling is democratic. It does not spare the precise nerve channels that enable your hands to function. Tailbone pain. Your tailbone hurts because it has become the shock absorber between your baby's descending skull and every sitting surface. As the baby drops into your pelvis in preparation for birth, the head presses directly on your coccyx, the small triangular bone at the base of your spine. Postural compensation shifts body weight onto the tailbone during sitting. The relaxin hormone softens ligaments connecting the coccyx to the sacrum, making it hypermobile. The bone that should remain stationary now flexes with every movement, and sitting creates direct pressure on already irritated tissue. The pain is sharp and bruised feeling at the very base of your spine. Sitting intensifies it immediately. The transition from sitting to standing creates acute stabbing pain. Some positions make it tolerable, others make sitting impossible. The discomfort radiates slightly into the buttocks. Soft surfaces provide minimal relief because the pressure point is so specific. Hard chairs are excruciating. Tailbone pain is most severe in late third trimester when the baby's head engages in the pelvis and remains there until delivery. Some women experience it earlier if the baby drops early or positions low in the pelvis. The pain is constant when sitting and during position changes, but improves when standing or lying down. Normal severity ranges from mild discomfort when sitting on hard surfaces to significant pain requiring cushions and position modifications. Concerning severity includes pain so severe you cannot sit at all, pain accompanied by loss of bowel or bladder control, or pain following a fall or trauma to the area. Your tailbone is the final shock absorber in a system where impact force has nowhere else to dissipate. It absorbs what cannot be distributed.